Dholakia is going to talk on white glow after nucleus emulsification.
Should I start? Is okay? Okay. So this is the video of a patient to whom I operated. The patient is practically having Morganian cataract, and we started doing phaco. This up to this stage everything was okay. We did completed wonderful CCC, and we started doing phacoemulsification of this patient. Even phacoing was also going wonderfully well. There was no any complication, though this was a very dense cataract, Morganian. But once I did my first job, I noticed that below the nucleus there is a white glow. I thought there must be a epinucleus big plaque, and this is the final nucleus piece. I'm emulsifying. Everything is going nice, and at the end I will be able to extract that epinucleus plate that was thought in my mind. But even after completing my phacoemulsification of the last plaque, last nucleus, the plaque is not coming out. So this video I edited 2-3-4 minutes, but it took long time to me to decide what to do. There is no plaque, there is nothing coming to the tip of the phaco tip end. So I decided to do it by bimanual irrigation aspiration, and I introduced my bimanual IA in the hope of getting out that epinuclear plate. No, it's not getting dislodged from anywhere. So there was no any conclusion, there was no any reference to me that such thing might have happened, that there is no epinucleus into the anterior chamber, and there is total white glow. There was no clue what is behind the posterior capsule. No anatomical structure was seen behind the posterior. There was no glow. All the glow was white. So I decided that I will be able to do, even after doing implantation of the IOL. So I tried even 7, 8, 9 attempts to remove the epinuclear plate, but it was not there into the anterior chamber anywhere. Finally, I decided to do the implantation of the IOL. After doing all these efforts, it was vain. As I said, this video is edited, but during each step, it was very difficult to take what next should I go for. So implanted the IOL, and in the hope that once I implant the IOL, if epinucleus plaque is anywhere into the anterior chamber, I'll be able to remove after implanting the IOL. The lens implantation is completed, and in the hope of getting out that white epinucleus plaque, still my hope was there. I'll be able to give the vision to the patient. But that was also of no use. I'm not getting out the epinucleus plate because it was not into the anterior chamber. All the epinucleus, all the cortical matter, all white nucleus and epinucleus might have melted and gone into the posterior chamber through this misdirected, what we call it misdirected aqueous flow. But it was pre-operatively. This patient was having cataract since many years. So finally I decided to give up, and I thought what nature has decided will come to the conclusion. Because I'm not, my time is up, but some time was wasted, so please bear with me. Finally, I just concluded the case, and now my next slide. So this was pre-operative B-scan USG. There was no concluding factor. It was showing PVD and some vitreous opacities. And this was the first day post-op picture. There was total white glow, and this is first week post-op, and it is same white glow was there. But between first day and first week post-op, there was little clearance of the white glow. So I was a bit hopeful that this lens matter will be absorbed, and I waited, and I asked my patient also to wait. My retinologist asked me to go for vitrectomy, but patient didn't agree, and myself and patient's relative were in favor to wait for still more. And this is first month postoperative, all lens matter were absorbed, and we prayed the God, and it worked. Do vipassana sadhana, do lot of things, you will definitely get answer. You will be able to, do it yourself and believe it. This is happening. Thank you very much. I think, I don't know, anybody has observed such a case in the past. I don't have any literature background that anybody in the world noticed that total lens matter going behind the IOL before surgery. So this was first case for me. And the way I tackled the case, I don't know whether it was right or wrong, but what I got the information from Almighty, I went ahead and I waited for 1 month whether the white glow will disappear by its own or not.
Did you put the patient on systemic
Post-operative we started a systemic steroid, local steroid, and that's it, NSAID. And yes, we started even timolong eye drops, local anti-glaucoma medication, so that we don't get IOP rise. But it was just wait and watch, wait and watch. Nothing more than that philosophy.
Sir, we have also come across such 1 or 2 cases. This is commonly seen in Morgagnian cataracts, long standing.
Yeah.
And usually it takes 1 to 3 months to resolve.
Get resolved.
The nature takes its own time.
Sir, have you presented this paper or anywhere?
No.
Somebody should make this paper and present it so all world should get the knowledge that this thing can happen somewhere in your life.
Thank you, sir.
Okay, sir. Thank you very much.
Dr. Naresh.